Good morning, everyone. It is 11 o'clock, so we'll go ahead and get started. I want to thank everyone for joining us today. This is the Rock County Public Health Department media briefing for July 8th. We start with some remarks from the Rock County Public Health Department, and then we open it up to questions from our media participants. So my name is Jessica Turner. I'm the communications specialist for the Rock County Public Health Department. And today I have with me Seth Longcar, Administrative Services Supervisor, Michael Niles, Health Educator, and Felicia Martinez, Public Health Nurse. So I'm going to turn it over to Michael. He'll be giving us our data updates for today.
Thanks, Jessica. So hi, everyone. So to date, there have been 16,435 Rock County residents who have tested positive for COVID-19 over the course of the pandemic. However, we do continue to see very low numbers of new cases. Currently, we're averaging about 1 new case per day being reported to the health department over the last week. Based on those who recovered from their illness, we're estimating that there are about 55 active cases in the community. We've also seen continued decreases in hospitalized patient numbers. Most recently, there were no patients in the hospital getting care for COVID-19 at the beginning of this week. Since our last media briefing, there has been 1 additional death due to COVID-19, which brings our total to 184 deaths since the start of the pandemic last March. Our department and our partners are still working to progress vaccination rates in our county. Currently, about 50% of the Rock County population has received at least 1 dose of the vaccine. Overall, just around 46% of Rock County residents have been fully vaccinated, and our department continues to work to increase this percentage through outreach and vaccination clinics. Thank you.
Thanks, Michael. I'm going to now pass it over to Seth, and Seth is going to give us some information about our testing and vaccination locations at the Blackhawk Technical College.
Great. Thank you, Jessica. So first, just touching on the vaccine site, as our numbers continue to fall, things are changing a bit. We want to remind everyone that the DHS AMI community vaccination site at Blackhawk Technical College will close next week. It is open today until 3 p.m., next Tuesday from 11 a.m. to 5 p.m., and then its last day will be Thursday, July 15th, with hours from 11 a.m. to 3 p.m. If you receive the first dose of a 2-dose vaccine at the site this week or next, AMI staff will help you find another provider to administer the second dose. For those who wish to be vaccinated going forward, vaccine providers and upcoming community vaccination events can be found by visiting rockcountyshot.com. We encourage to everyone who is able to be vaccinated, please do so. Take advantage of the last few days at the community vaccination site at Blackhawk Technical College, contact your existing provider, or select an alternative option at rockcountyshot.com. The higher the percentage of vaccinated individuals in the region, the more likely we will be able to maintain the lower numbers of cases we've been seeing of late. Regarding the testing site, the testing services at Blackhawk Technical College are also winding down. Free COVID-19 testing has been available on Wednesdays and Thursdays from 12 p.m. to 5 p.m. at the Blackhawk Technical College campus, located at 6004 South County Highway G in Janesville. Testing began on October 21st, 2020. The site's final day for testing will be July 22nd, 2021. Alternative testing options include our local healthcare systems and providers, pharmacies like Walgreens and CVS, and a variety of at-home test kits you can pick up at local pharmacies and superstores. For a complete list with more detailed information, please visit our website at www.co.rock.wi.us/public health. Click on the coronavirus link and then select the testing section of that page. We will make every effort to keep testing locations up to date at this link on the Rock County Public Health Department's website. Regarding the continued importance of testing and vaccination, we strongly urge everyone to continue to test if exhibiting COVID-19 symptoms. Testing is especially critical given the proliferation of the Delta variant. Data suggests that the Delta variant spreads more rapidly and easily than the original strain. Testing helps us identify, track, and quarantine new cases before additional spread occurs. It is key to maintaining the low COVID numbers we are now seeing. It's also helped us prevent new variants that may be even more difficult to fight from emerging. Help us avoid a widespread surge in the fall by being cautious right now. Test if you have symptoms. We also can't stress enough the importance of vaccination given emerging strains like Delta. Delta is increasing in this country and impacting young people in a way that previous variants have not, causing severe illness. In some regions, the Delta variant now represents over 50% of cases reported. Fortunately, we do know how to deal with this. The COVID-19 vaccines available in the US have been shown to provide protection against the Delta variant. So, people who are fully vaccinated are protected from the Delta variant. And the sooner people get vaccinated against COVID-19, the less opportunity for the virus to keep mutating. Some may try to counter this by pointing out that vaccines are not foolproof. Yet, while vaccines are not 100% effective, the rare vaccinated individuals who do contract COVID is much less likely to get severely ill. This is very important when thinking about mutated strains like Delta, which are more transmittable and possibly more likely to lead to severe illness in all age groups. So please, if you think you are immune to being severely impacted by this virus, you are not. Don't let COVID fatigue or misinformation sway you. It is critical that you get vaccinated to protect yourself and others. Thank you, Jessica.
Yes, thank you, Seth. And now Felicia will give a little bit more detailed information about some of the vaccination opportunities coming up in the community.
Hello, everyone. My name is Felicia Martinez, and I have some community clinics updates for you. So for those who are not yet vaccinated, we have many opportunities coming up to make this as easy and convenient as possible. For those who are homebound, we continue to have our homebound program. We have increased access. Your caretakers may be able to be vaccinated at the same time if they wish. Please call 608-352-6727 to schedule an appointment with us. We also have a number of upcoming vaccine clinics, including at the DeLong Company in Clinton on Saturday, July 10th from 10 a.m. to 4 p.m. Also at Hackett Elementary School in Beloit, we'll be providing shots on July 14th from 11 a.m. to 1 p.m. July 14th and August 4th. Sorry. Also the Beloit Woodmans on Saturday, July 17th from 10 a.m. to 4 p.m. And then also at the Janesville Woodmans, we will also be offering vaccinations on Saturday, July 17th and August 7th from 10 a.m. to 4 p.m. And then at the Wilson Elementary School in Janesville, we'll be offering vaccinations on July 19th from 11 a.m. to 1 p.m. And then also at Merrill Elementary School in Beloit, they will also be offering vaccinations on July 28th from 11 a.m. to 1 p.m. To find additional information and details about vaccine clinic opportunities, please visit rockcountyshot.com/locations. Rock County Shot also offers a wealth of information on COVID in general, on vaccinations. So please visit rockcountyshot.com for more information. It is frequently updated. It's a frequently updated cooperative effort targeted at Rock County residents to help match residents to vaccine resources. We want to be sure every individual that wants a vaccine has easy access to one. We encourage Rock County residents to please take advantage of the free and convenient options that are available. Thank you.
Thanks, Felicia. That concludes the Public Health Department comments for this briefing. So I'm going to turn it over to the media for questions. And it looks like today we have Austin Montgomery from the Beloit Daily News joining us. Austin, you are our only participant today, so we will give you the ability to mute and unmute yourself, and you can ask whatever questions you have.
Hi, thanks guys. I appreciate you guys doing this. Wanted to check in. I know I'd asked you, Jessica, this yesterday, but still haven't heard back from DHS on an exact number of vaccines that were administered at the Blackhawk Tech site. Just wanted to see if you were able to come up with anything, any concrete numbers, even if it's just a ballpark figure of how many doses were administered. We were curious about that.
I was not able to get that number for you yet, Austin, but I am still checking into it. So as soon as I am able to get some sort of ballpark or actual number on that, I will let you know.
Thanks. Next question. We've been at a point for a while now where there's been enough vaccine to go around to all providers who are administering them. But just kind of wanted to check back in as the center closes at Blackhawk Tech. What's the state of the vaccine supply currently in Rock County? I mean, I assume it's pretty strong, but just wanted to double check.
Yeah, this is Jessica again. I can answer that. We do still have a very strong supply of the vaccine in the community. We have quite a few vaccine providers, and they are all receiving enough vaccine to go around. So we do have enough for anyone who would like to get vaccinated.
And just with the new Delta variant coming out, and I think there are some concerns around kind of just how contagious it is. Just wanted to reiterate that the vaccines, both Pfizer, Moderna, and Johnson & Johnson, all have effectiveness against preventing breakthrough cases of the Delta variant for people. Just wanted to kind of get that on the record and get something from you guys on that. Thanks.
Sure, I can take that one again as well. That's a great question, Austin, and thank you for the opportunity to clarify that. All three of the vaccines have shown a high level of protection against all of the different variants of concern. So that is why we are stressing that everyone get vaccinated, because any natural immunity that you may have from having the disease would not protect you from any of the other variants. And being vaccinated, even if you were to contract the virus, because there are those rare cases where we do have those breakthrough cases. But even if you do contract COVID and you are vaccinated, you will have less severe illness. All of our hospitalizations that we're seeing are primarily among those who are unvaccinated.
And just kind of looking forward, I know there was something kind of mentioned about the importance of getting vaccinated now so we don't see a surge in the fall. Is there some concern about if the vaccine rate stays where it's at right now for Rock County, just hovering around 50%, that there will be an increase in cases once we head into the fall and winter?
That is definitely something that that we will be monitoring, and something that is somewhat of a concern, because once we get back into the fall, there are more opportunities for people to gather. The weather gets a little colder, people move indoors, and with schools reopening in the fall, you have all those kids, many of whom are not eligible to be vaccinated, all coming together in the same place. So it's definitely an opportunity for the virus to spread in those situations.
All right, just my last question here. We know that Rock County was really fortunate to have the DHS clinic so early. And Jessica, I think you had touched on this yesterday just a little bit, but not sure if you or someone else wanted to reiterate just how valuable that asset was, because I think early on we had seen pretty slow vaccine uptake, just one, because supply was low, but then too, because access was limited for people. But just want to reiterate the importance of being able to get the Blackhawk Tech site when we did, and just talk about that. Thank you.
Felicia, did you want to chime in on this? Do you have anything to add?
Yeah, I 100% agree with you, Austin. Our ability to have the site out at Blackhawk Tech was a huge advantage and wonderful resource for our community. 100% agree with you. And I do think that maybe it helped, I know that it helped initially in the beginning with the vaccine distribution with our 65 and older population and our healthcare worker and frontline workers. It was a wonderful resource for all of those, and they have done a fantastic job of vaccinating our community and our surrounding communities. But yeah, that was kind of all I really want to say, is that I agree with you. It has been a wonderful asset, and it's still there for people to use until next week. And hopefully people that haven't been already vaccinated will go out there and use that resource while it's there, because it's free. Walk-ins are available. Children, as long as you go with your parents, you're able to get vaccinated. So they're able to meet the needs of many people. So it's been a really great resource.
Thanks, Felicia. I just wanted to add one more thing, Austin. This is Jessica.
Yep. Okay.
Yeah, just a reminder that at the beginning of the vaccine rollout, most of the providers that had vaccine were those healthcare providers. And so while they were well equipped to distribute vaccine, because it is something that is within their wheelhouse on a normal, in their normal routines, it kind of created a barrier for those people who maybe didn't have insurance or a regular healthcare provider, and may have been unsure about whether or not they could go to one of those healthcare systems to get vaccinated. So having that neutral, central community vaccination site was a real advantage for us. And we were very fortunate to have that early on, when it may have been more difficult for those uninsured people to find a vaccine provider. And it also provided our community some additional time to kind of mobilize, and some of those people who maybe aren't as experienced giving vaccines or giving vaccines on this large of a scale, to be able to put systems in place and to mobilize. And now we have a lot of different opportunities for people to get vaccinated. So that that site really helped us fill in the gaps while some of our vaccine providers were putting their systems in place and mobilizing.
Just thought of one last question as we were kind of talking about this to kind of wrap up here. With being able to have that increased access, just going forward, you want to reiterate just the health department being visible and kind of talking about what's next? Obviously, we heard about all the upcoming clinics and things like that. You just want to talk about what the health department is going to be doing to kind of stay visible and to let people know that there's still opportunities to get the vaccine even with this central clinic closing?
Can I touch on that a little bit? Okay. So, I mean, we have ongoing efforts out in the community. We are doing some ongoing outreach to our Hispanic and African-American communities. And by doing that, we're going out into the public, hanging up flyers, talking with people. We're also doing Facebook Live and interviews with different Hispanic radio stations, really trying to get the message out and all of the accurate information out to as many avenues as we can. And that's going to be ongoing we're trying to strategize and figure out what works best for different demographics and different communities. But all of our efforts are ongoing, and our presence hopefully is being seen in the community, because we are out there and we are trying, and it is ongoing. So I don't know if
I don't have any
Jessica,
questions.
you want to
Thank
add?
you, guys.
Yeah, thanks, Felicia. Austin, did you have another question? Sorry.
Nope, no more questions from me. Thank you.
Okay, great. Yeah, thank you. And thank you for attending, Austin. So that will conclude our briefing for today. I want to thank everybody who's been watching the Facebook Live, and for everybody who will be watching the recording of this. The recording will be available on our Facebook page and on our YouTube channel. Our next media briefing will be in 2 weeks on Thursday at 11 o'clock. So please tune in again in 2 weeks, and we will see you then. Have a great rest of your week. Be safe and be healthy.